I'm with Dr. Scott Lear, the Pfizer Heart and Stroke Foundation Chair in Cardiovascular Prevention Research at St. Paul's Hospital. Dr. Lear, what is the My Health Connect pilot research project, and how did you get it off the ground and running?
So My Health Connect is a model of care that supports patients in their self-care using a web-based portal as well as telephone supports from a nurse, dietitian, exercise specialist. And it essentially helps patients monitor their symptoms and alerts the healthcare professionals whenever there are symptoms that are progressing. Now, we got it off the ground by putting together a clinical advisory committee that included patients, family physicians, specialists, nurse, allied health professionals, as well as the design team. And over a period of about 6 to 8 months, we developed multiple iterations of My Health Connect and got the model of care down before taking it out to larger investigation.
Great. And what was the motivation behind creating this web portal, and how does it help doctors and staff care for patients with chronic conditions?
Well, we've targeted My Health Connect with the vision of reaching out to patients in their communities and homes who live in small urban and rural areas with chronic diseases. And these are areas in the province where the patient might not have access to things like cardiac rehab centers if they have heart disease, respiratory clinics if they have lung disease, diabetes teaching centers, and so forth. So what we wanted to do is try and bring that type of supported care to the patient, and also in that way supporting their family physician and the patient in caring for their chronic disease.
How might this type of innovative technology help to meet the growing healthcare needs in BC and throughout Canada now and into the future?
Well, one of the benefits and one of the reasons we targeted internet-based and web-based technology as well as using telephones is because these technologies are all over the place. Most people have internet access at home and have computers and telephones, and so that makes it readily scalable. There's not a huge infrastructure cost to start it up. And we use a very simple model, and it works within the practice of the healthcare system. So we're not creating anything new, we're just augmenting it. So in that way it makes it quite scalable, and we could see this benefiting patients throughout the province and going beyond British Columbia as well.
That's very exciting. Thank you very much.
Okay, thank you.